Okay, quick quiz. In what sport do you see the most ankle sprains? I'm going to give you the answer. Basketball. It's 45% of all ankle sprains are in basketball. Number two, soccer. It's about 31% of all ankle sprains are seen in soccer. Then volleyball, and it's about 25%. It's a very common injury. In some studies, it may be the single most common sports injury that you see. But remember, an ankle sprain is not just a sprain. Usually the player comes down on their foot and it inverts. It rolls in. They feel like they landed on the side of their foot. It could be made worse if you land on something like a foot, another player's shoe, that sort of thing. Sometimes the foot, you can just correct yourself and carry on with the game. Sometimes it feels like it almost dislocates, goes to about 90 degrees, and the player falls to the ground. I will tell you that it's a ligament injury. Ankle sprains are a ligament injury. Ligaments attach bone to bone, unlike a tendon, which is attaching muscle to bone. A ligament attaches bone to bone. So on the outside of the ankle, we have three major ligaments. We have the ligament that goes from the distal fibula to the side of the talus, and it's called the talofibular ligament. It is the most commonly injured ligament with a sprain. Also, you have the calcaneal fibular ligament, which is on the side of the foot coming down from the fibula, goes all the way to the calcaneus. And then you have the posterior talofibular ligament. It is a very thick, broadband ligament, thicker than my thumb. It is rarely injured, but it can be as well. The most common injury is to the very thick anterior talofibular ligament, which is in the front part of the ankle. There are grades of ankle sprains too. A grade 1 injury is when you just stretch it. A grade 2 injury is when you partially tear it. A grade 3 injury is when that ligament just completely separates. That's a very significant injury. And I will tell you that athletic trainers are really good at this sometimes just by getting a good history. If the player goes down or sprains his ankle, has that inversion injury, and they're able to maybe sit down for a few minutes or even continue to walk or run or play, and then they have some swelling at the end of the game, that's probably a grade 1. A grade 2, the player goes down. They can get off the field by themselves. But that's a grade 2 pretty much. A grade 3, player goes down, has to be carried off the field. If you just use that kind of clinical presentation, you're going to be right 85 to 90% of the times. And that's usually what the athletic trainer can tell us, and the history is really important. Keep in mind also, if you twist your foot, not just ligaments can be injured. So a lot of people will just, wave it off and say it's just a sprain. Not only can you injure the ligaments, there's a tendon called the peroneals that goes on the side of the foot. That can be injured as well. You can land so hard that you break a bone. Fifth metatarsal is right here, and it can be injured. And the player is going to think the pain's all on the side of the foot. They're not absolutely certain, but it certainly can be injured. You can break the fibula bone as well. So these are injuries that you need to think about in your differential diagnosis, or think about when you have a sprain or fall off on the side of your foot, and you need to examine these or keep them in mind when you're looking at a patient who has a sprain. It more likely than not are the ligament injuries or the ligaments that are injured during this kind of injury. But you also need to keep in mind that the tendons can be injured, the bones can fracture, and it's not just a sprain. It's probably the most common, significant sports injury that you're going to see. And again, 45% of all ankle sprains, basketball. Most common sports, basketball, soccer. You also see them in football, but this kind of inversion injury, very common injury, so you need to know how to treat it.
So we're going to tape an ankle right now. Usually what I look for is I look at the calf muscle and look for where the calf muscle starts to change into the Achilles tendon. And that's usually about here. And then we'll start our pre-wrap. Our pre-wrap is just to prevent skin irritation and usually in males to prevent the hair being pulled out by the tape. So we want to just get a nice even layer of pre-wrap all the way around. Just like that. And then we're going to start with our anchor strips. So our anchors are going to start at the top, right here, and down here at the bottom of the foot. And these anchors are going to provide support for the rest of the strips that we apply. The first strips that we're going to apply start from the outside here and come towards the inside. So we're going to cover the ankle bone right here and lock the heel into place.
You can cut that one right there.
And then what I like to do is kind of like an X effect with these next strips. I start in the back right here and come around to the front side on the medial side.
No, where are you going?
Again, I'll start on the
No.
more anterior aspect right here, and then switch to the most posterior aspect on the medial side. Once I get to this point, I kind of like to hold these guys in place, get a few strips going around. Once these guys are anchored down, we're going to do our heel locks. So we're going to start here, come around the heel, back up and around. And now we're going to go to the other side and come back up and around. So we have one on each side so far. I usually like to do two. So we're going to do that again and cover up all these little yellow spots of pre-wrap. Right there. Boom. Right here is about the time where I ask them if they need any more support or anything like that. And if they like what I've done so far, I just close it up. And closing it up just entails covering kind of all the tape ends so that when they roll their socks up and put all their game cleats on and all that good stuff, it doesn't get ruin the tape job. And that's all.